I'm going to show you how to fill the initial chart of a patient. So when we start with a patient, we have the clinical image of the patient. In some cases, we have images of the crowns, images of the clinical aspect, and we can also have OPGs. So let's say I take one OPG, I load my OPG on the patient's file, and when I add this, automatically my OPG is coming inside the data of the patient, and it is coming in the patient chart by default. The last one will come here, and this is what we have and what we are starting with. So if you want to see it in a better way, you can click on that and you have it in full screen on this page. So let's go back. You have three levels: the current level, where you are going to implement procedures, implement the diagnosis, implement what you are doing, the work. You have initial, this is the initial where we are starting from, and treatment plan. So first of all, we go to initial, and we are going to do exactly the same thing as we see here. Okay, so in the chart, I have been making a certain number of things like this, and you can implement whatever you want. So we can remove some things, some teeth, like this one. We can remove this one, which is not present also. We can remove this one. And then we can put an implant and abutment, or implant, abutment, and crown. So instead of removing the tooth, placing an implant, placing an abutment, placing a crown, we have a special icon like this, where we have a crown on implant. When I click here, I see crown on implant on one tooth. So I can click here on one tooth. It will give me one implant and one crown on one implant. I can do exactly the same on this side, one implant and one crown on implant. So now we have a crown at the back here, and we have crowns with root canals here. So I put a crown on this back tooth, which is a living tooth, and I put a crown and root canal on these two teeth. So here I have something else. In position of the second premolar, I have one implant. So I click on one implant. No need to remove the tooth first. It will be done automatically like this. And the lower is done. So now we go on the upper. We have all crowns with root canals from the central to the last tooth. So I click on this. From the central, I have all the teeth here. Okay, but I have more than that. I have one root at the back, okay, root and post. So I keep this one. And I have three implants here, which have been placed. They have not been activated. So I click on the three implants. Okay, they are coming as implants now. You have a root which has been done here, but only a root. So I click on root, I click here, and I add the crown on this tooth, which has been adding. Okay, so now we have all, and we are starting from that. So when we go to current, we will be able to work on the current treatment based on the initial chart. What we can do also, we can work on the treatment plan, and on the treatment plan, we are going to use all what we have been doing in my procedures, your procedures, and you will select what you want to do. So I have been starting with the initial state, which is coming from the clinical aspect and from the radiological aspect. Based on these two things, now you can select, you can magnify, you can check here that you've been doing the things in a good way, and you can come back to the initial step. I thank you for your attention.